Hello, my name is Axel Nilsson. I'm an SRNA with Murray State University, and in this presentation we'll be discussing how educating anesthesia providers on utilizing dexmedetomidine before surgery can help reduce perioperative opioid use. Opioids have been the go-to medication for pain management for a long time, but they come with a number of side effects. These side effects can be serious and even deadly. This project aimed to educate anesthesia providers about dexmedetomidine, or Precedex, a medication that can be used to help reduce opioid use without causing any of these harmful side effects. Precedex is a relatively new medication that offers a number of advantages over opioids. It does not cause any respiratory depression, which is a major concern with opioids, and can also help to improve hemodynamic stability, which is important for surgical patients. The opioid epidemic that is currently going on is a serious public health crisis. Opioid use and misuse has been on the rise for decades, and millions of Americans are now addicted to opioids. In 2017, the United States actually declared an opioid epidemic in order to focus on better creating practices for pain management. Opioid-based anesthesia can have a number of negative effects on surgical patients. These side effects can make it very difficult for patients to recover from surgery and can even be life-threatening. Some of the side effects are PONV, or postoperative nausea and vomiting, increased sedation, respiratory depression, increased risk for ileus, and potential for addiction, as we know. ERAS stands for Enhanced Recovery After Surgery. ERAS protocols promote a multimodal approach to pain management. This approach incorporates a variety of pain management techniques, such as regional anesthesia, non-steroidal anti-inflammatory drugs, and acetaminophen. By using a multimodal approach, clinicians can reduce the need for opioids and improve patient outcomes. Precedex is unique in that it can actually be used as an opioid-sparing agent, which provides sedation and analgesia, yet it does not cause any respiratory depression. It reduces the needs for opioids in the perioperative setting, making it the perfect adjunct to use with ERAS protocols. So to complete this project, a thorough literature review was essential to gather enough evidence on opioid-sparing anesthesia. Specific search terms used were dexmedetomidine, opioid-sparing anesthesia, opioid-free analgesia, ERAS, or enhanced recovery after surgery, and multimodal analgesia. These search words were chosen to target specific and relevant studies. Inclusion and exclusion criteria ensured the studies focused on the area of interest. The databases utilized for this research were Google Scholar, PubMed, and UpToDate. These databases are reputable sources of medical literature and provide a wide range of studies for the review. The literature review revealed strong evidence that opioid-sparing anesthesia, specifically using dexmedetomidine, is an effective approach to reducing opioid dependence, abuse, and overdose. Opioids have been used for pain relief for thousands of years. The first opioid isolated was morphine, derived in 1847. This led to widespread use of opioids in the clinical practice. Opioids work by binding to opioid receptors in the central nervous system. There are three main types of opioid receptors: the mu, delta, and kappa. The mu receptor is responsible for analgesic effects of opioids, but it also reduces consciousness and respiratory rate. Opioids can also cause euphoria, which make them target of abuse. Opioids cause a number of other side effects, such as the ones we discussed earlier: PUMB, dizziness, fatigue, also can cause bradycardia, and even chest wall rigidity. Dexmedetomidine is a medication that was introduced in 1999. It works differently from opioids in that it is a sympatholytic drug, which means that it works by decreasing the activity of the sympathetic nervous system. It acts on alpha-2 adrenergic receptors. Precedex provides sedation, anxiolysis, analgesia, and more. It helps to maintain stable hemodynamics during surgery. Alpha-2 agonists like Precedex work by binding to specific receptors in the brain called alpha-2 adrenergic receptors. These receptors are further classified into three different subtypes with distinct functions. The alpha-2A plays a role in pain relief, while alpha-2B causes blood vessel constriction, and alpha-2C influences dopamine signaling and behaviors. Dexmedetomidine's pharmacokinetic profile is characterized by rapid distribution throughout the body after intravenous administration. The drug has a short distribution half-life of about 6 minutes, followed by a longer elimination half-life of approximately 2 hours. It is highly protein-bound and has a large volume of distribution. An interesting feature is the context-sensitive half-life, which changes depending on the infusion duration. Dexmedetomidine undergoes significant first-pass metabolism, rendering oral administration less effective. However, sublingual and intranasal routes offer a more efficient delivery method. The drug is extensively metabolized in the body and requires dosage adjustments in the patients with liver or kidney problems. Precedex has a specific effect on the cardiovascular system. It causes a slowing of the heart rate and a change in blood pressure that initially goes up, followed by a subsequent decrease. Overall, it reduces the norepinephrine in circulation, leading to a slight decrease in blood pressure and heart rate. This unique profile makes it valuable in cardiac surgery, where it can lessen the stress response and protect the heart during the procedure. A study involving over 3,000 patients showed that alpha-2 agonists like Precedex significantly reduced heart attacks and death during vascular surgery. Precedex's ability to lower heart muscle oxygen demand is thought to be a key mechanism behind its cardioprotective effects. Dexmedetomidine's effect on the central nervous system is also unique. It produces a state of sedation where patients can easily be awakened, cooperate with procedures, and then return to sleep when left awakened or undisturbed. This cooperative sedation is achieved through its effect on subcortical brain regions that closely resemble natural sleep. Furthermore, dexmedetomidine has significant pain-relieving properties, reducing the need for opioid medications. It works by inhibiting the release of pain-signaling molecule called substance P in the spinal cord. Additionally, dexmedetomidine enhances pain-blocking effects of opioids and reduces overall pain transmission in the brain. These properties make it valuable in neurosurgery, where the brain is protected. Precedex's ability to lower brain stress hormones and improve blood flow is very beneficial in this setting. It's particularly useful in awake craniotomies, which require the patient to be alert and stable and participate in neurological assessments during the procedure. Precedex stands out from other sedatives because it has minimal effects on breathing even at high doses. Patients on Precedex experience a sleep-like state with no significant changes in gas exchange or respiratory rate. This feature allows healthcare providers to confidently wean patients off the ventilators and while they remain calm and cooperative. Precedex also has an anti-sialagogue effect, which means that it reduces saliva production. The wide safety margin of Precedex is one of its major advantages. This means that there is a large window between the therapeutic dose and the dose that can cause serious side effects. This makes Precedex a good choice for patients who are critically ill or who have other medical conditions that make them more susceptible to side effects than other medications. The most common side effect of Precedex is hypotension and bradycardia, followed by dry mouth and nausea. These side effects are usually mild and can be managed with supportive care. Dexmedetomidine offers a unique combination of effects that make it ideal for pre-induction sedation. It promotes calmness, reduces anxiety, and lowers the body's stress response, all while maintaining the patient's ability to breathe on their own. This combination of benefits provides a smoother transition to anesthesia. Dexmedetomidine offers several advantages during induction over other agents. It helps to prevent a significant increase in heart rate or blood pressure associated with a DL, an endotracheal tube placement. Additionally, it allows for lower doses of opioids and volatile anesthetics during the procedure. Studies have also shown that dexmedetomidine can decrease patients' oxygen requirements during surgery. The recommended dose for dexmedetomidine for pre-induction sedation varies depending on the route that you give it. It is typically given approximately 15 minutes before surgery, but can also be administered intramuscularly or even intranasal or PO. Dexmedetomidine works relatively quickly, although it starts to take effect in about 5 minutes, although peak effect is at 15 minutes, and will maintain its duration of action for approximately 2 hours. The intravenous dose recommended by most of the studies that I found was somewhere between 0.3 and 0.67 mics per kg. The use of dexmedetomidine extends beyond pre-induction sedation. It is valuable in various clinical settings, including procedures requiring sedation, facilitating awake intubation for specific cases, and providing pain relief and hemodynamic stability throughout surgery. Dexmedetomidine offers a broad spectrum of benefits beyond sedation. It can provide pain relief, reduce anxiety, and minimize postoperative nausea and vomiting. Additionally, it can help to decrease postoperative pain, delirium, and the incidence of shivering. So I did a cost-benefit analysis on the use of Precedex as well, and a vial of dexmedetomidine costs around $42, while a vial of fentanyl costs only $7. While it seems like a big difference at first, the cost-benefit analysis shows that the use of dexmedetomidine is accompanied by shorter PACU stays, faster discharges, and improved patient satisfaction. A study done in 2020 showed that dexmedetomidine reduces hospital stay and overall cost. So the setting and target population for this project were a small level 3 community hospital in Northeast Kentucky. They offer a variety of ambulatory surgery and emergency care. They are accredited by the American College of of surgeons. And the target population that I chose were CRNAs and anesthesiologists in the practice. The strategies I used to implement this practice change were educational handouts that were placed on every anesthesia cart, and one-on-one education with each of the providers that I was able to do while working with them as a student. And then we also did a poster board presentation for key stakeholders in the educational realm as well. So for the project, I had all of the anesthesia providers complete a questionnaire before and after the education was provided. This questionnaire assessed each of the providers' comfort and their perceived level of education regarding Precedex. And then after, asked many of the similar questions to see if there was a change. These questionnaires were available by both paper and smartphone via QR code. The sustainability of this project was measured based on the buy-in from key stakeholders within the department. The most important part of the whole project was to not just get everybody to use Precedex, but to change the kind of the culture and the thought behind the use of Precedex, and incorporating a different multimodal adjuncts into their practice. This kind of forced CRNAs to maybe step outside the box a little bit when they're providing inpatient care. So to summarize the results, one of the key factors that I was looking at was the perceived knowledge that anesthesia providers felt that they had regarding the Precedex. And the pre-education survey results showed an average of 3.25 out of 5, and the post-education results showed an education score of 4.08 out of an education level of 5. This shows a 25% increase in their comfort level regarding Precedex, and ultimately this correlated with a 66, with an increase of about 66.6% regarding the use of Precedex. The results of this project speak volumes to how a true practice change actually occurred. The quantitative data confirms a successful practice change, while the qualitative endorsement received from the anesthesia department implies how the practice change will continue to provide a long-term impact. The limitations for this project were a small sample size, which limits the generalizability of the results, and that it was a single center project. And as far as recommendations for future work, I would recommend to conduct a larger multi-center study, and possibly exploring different educational tools that can be utilized for a wider dissemination of research. Ultimately, this project showed that one-on-one education with the addition of educational handouts can be a successful way to promote a practice change within an OR. Moving forward, this promotes better patient safety as well as satisfaction. Precedex offers a promising future for pain management while still ensuring high quality anesthesia care. Thank you for your time.